Today we'll start with a COVID update, specifically focusing on latest developments and information coming from Northland. We'll then move to an update on vaccine approval and rollout, following which we'll be very happy to take questions. The current Northland COVID case is a situation that is very obviously unwelcome, but also that we have prepared for. The global pandemic continues to rage around the world, and as we have experienced before, from time to time, we will be reminded of that pandemic and just what a tricky virus COVID-19 is, even with our very best efforts. What is important is our response to incidents like this, and of course what we learn from each incident so we can do our best to try and prevent it from ever happening again. On that note, I'll hand over to Minister Hipkins to give you some of the latest.
Thank you, Prime Minister. I'm pleased to report there are no new cases in the community to report today. 16 people have been identified as potential close contacts of the previously reported case in Northland. Of those, 15 people have already returned their negative tests. One test result is still pending. Contact tracing staff are following up with 357 people who departed the Pullman managed isolation facility between the 9th and the 24th of January. Of that number, 325 have been contacted. They are isolating and they have been or will be tested. The remaining former guests are being followed up today. A total of 157 staff from the managed isolation facility at the Pullman Hotel have been tested, along with 192 guests currently in the facility. With around 30 test results still to come, all of the others have returned negative results. 187 people have received push notifications as a result of having scanned into one of the locations of interest. At this time, 154 people have been identified as casual plus contacts, either as a result of push notification or because of a conversation that they have had with Healthline as a result of media publicity. They are all isolating pending test results. The investigation into the source is still continuing, and that includes the review of CCTV footage and so on to try and identify how the transmission between the two people may have occurred. We have had a number of calls to Healthline asking for the definitions of casual contact and casual plus contact, close contact and casual or casual plus contact. So I want to share that now. A close contact is someone who's more likely to be at higher risk of being infected because they have spent time in close proximity to a confirmed case during the case's infectious period. A casual or a casual plus contact is someone who's had only limited exposure to the confirmed case, usually because they have been in the same location as the person of interest at the same time. So that is the distinction. So the close contacts are the ones that we focus urgently on. Casual and casual plus contacts are much lower risk, but there's still some risk, so we do work hard to try and identify those and ensure that they are tested. I can confirm that yesterday more than 1,500 people were tested at community testing centres around the Northland region, and the Northland DHB informs us that on a testing per 1,000 basis, Māori were tested on far greater proportion than any other ethnicity during that time. We are experiencing delays in testing. I want to remind people, if you are not a close contact, a casual or casual plus contact, and you're not showing symptoms, please don't line up for testing because it's preventing the people who are more at risk and who we do need to get tested from being able to access those tests. If in any doubt about whether or not you should seek a test, please call Healthline. If you're not showing symptoms, if you're not on that identified list of people who may be more at risk, call Healthline if you have questions or want any further information.